I'm Dr. Bud Holcomb. Today I'd like to talk about sleep and sleep problems. Many biological functions run on a cycle called circadian rhythms. The brain needs to know when it's time to sleep. That's why a regular sleep schedule is so important. That means in bed at the same time, out of bed 8 hours later. No naps during the day. Bed is for sleep and sex only. If good sleep habits are not in place, we can't expect to sleep well. Along these lines, nobody wants to be awake at 8 a.m. with nothing to do. So the best thing you can do to set your sleep habits is to have somewhere you have to be with other people. This is hard if you don't have to go into work at a set time each day. Inevitably, people will stay up to the early morning hours, then sleep late into the day. A good trick is to join an exercise class or volunteer community where you're expected to be with other people in the morning. This really helps set a good sleep cycle. As with treatment for any disorder, the first thing that must be done is to take away anything that makes it worse. There are many things that make sleep worse. It's very clear that alcohol disrupts the quality of sleep. Many people use it to go to sleep, but the quality of sleep is greatly diminished. Since the brain does not have a lymphatic system, which is kind of like the sewer system for the body to transport and dispose waste, I like the recent theory that the purpose of sleep is to cleanse waste products from the brain. If the brain is polluted by alcohol, it feels toxic the next day. Similarly, if we don't sleep for long enough periods, we feel groggy or less sharp, as if the brain has not had enough time to clean out the waste. Being underslept or groggy greatly diminishes our capacity to function. Nicotine and caffeine are both stimulants and so make insomnia worse. Many people take in most of their nicotine after working hours at nighttime. Not only does this cause problems falling asleep, but when the nicotine wears off, people wake up in the middle of the night from nicotine withdrawal. After taking away anything that makes it worse, any disorder should be treated with as few pills as possible and as much addressing the problem at the source. I like to say, when you hear hoofbeats, think horses, not zebras, meaning think common causes first. The most common cause of insomnia by far is anxiety or stress or worry. They are all one and the same. When you can't shut your brain off to fall asleep at night, that's likely anxiety. The source of anxiety must be treated as well. People tell themselves, if I could just get a good night's sleep, then everything would be all right. Michael Jackson just kept upping his sedatives until he needed propofol, an IV general anesthetic, to fall asleep each night. Please see my earlier video on recognition and treatment of anxiety. As far as treatment goes, there are many good apps that practice guided relaxation by voice to ease someone into sleep. It's much harder to focus on your external worries when you are focusing on a guided meditation. These really are helpful. They're readily available and very affordable. As for medication, please consider diphenhydramine or Benadryl. Most over-the-counter medications for sleep and many prescription sedatives are antihistamines. This is over-the-counter, it's cheap, and very effective. 50 to 100 milligrams is a good dose. This is the agent in Tylenol PM or Motrin PM or other over-the-counter sleep medications. But you don't need the Tylenol or other components, just the diphenhydramine. A caution with sedating antihistamines is that they are very sedating the next day. However, this adapts quickly, and soon the medication isn't so sedating in the morning, but still effective for sleep. Many people try melatonin as an over-the-counter sleep aid. Melatonin is an important hormone that increases in the dark and helps initiate sleep. This is why it's important to not be exposed to UV light from TV or electronic devices prior to trying to sleep. Melatonin is effective to address jet lag, but doesn't seem to be as effective for common sleep problems. Of course, there are many prescription medications that are very effective. Every doctor has their personal favorites, but there are unlimited choices. Many people with high anxiety or PTSD experience very disturbing nightmares. It's important to know there is a prescription medication called prazosin, which is a medication for blood pressure that is highly effective in reducing and eliminating nightmares. Working up or titrating to a dose of 5 milligrams, one pill at bedtime, is a good dose. Not many doctors other than psychiatrists know about this, so speak to your family practice doctor if you're having nightmares. To summarize, number 1, good sleep habits are very necessary in order for the brain to know when to sleep. Out of bed at the same time each day, in bed 8 hours earlier, no naps during the day. Bed should be for sleep and sex only. Nobody wants to be lonely at 8 a.m., so it's important to have somewhere you have to be with other people in order to get up at a healthy time. Number 2, take away anything that's making it worse. Alcohol, nicotine, caffeine, afternoon, and UV light before going to sleep. Number 3, as few pills as possible. Diphenhydramine or Benadryl, 50 to 100 milligrams, approximately an hour before bed, is an effective choice. And number 4, as always, you must address the problem at the source, which for insomnia means treating the underlying anxiety or stress and depression. Please see my earlier videos on these topics. Thanks for listening.